So, like I said, my name is Shelley. I've been a nurse 30-some years. I've had various experience. I started nursing in San Francisco kind of during the AIDS crisis, so I had a lot of experience with that. And then my husband and I ran a business for a long time doing continuing education. I worked at DMC, I worked all over, but hospice is my happy place. I will say that. I found my happy home. Okay, so if you have a phone or a piece of paper or a pen, take it out. I just want you to jot something down on your phone. So just open up Notes app or the piece of paper. There's no test involved. This is just for you. So it is just for you. Go on your phone with your piece of paper. Write down 3 issues if you are a caregiver, because we have several caregivers here, that frustrate you. Okay? 3 situations that you're like, when I am providing care for my loved one, it drives me crazy when 1, 2, 3. Does that make sense? Now, if you're in social services and you're more in the supportive role, what do they say to you? What are your families saying to you? Does that make sense? Oh, I go crazy when my husband does this. Okay, so 3 things. All right. Take a second to think of those 3 things. And like I said, this is just for you. We're not collecting it at the end of the day. But there's a reason I'm having you write it down, and that's because I want to, at the end, make sure that those 3 things were addressed. Does that make sense? Mm-hmm. Okay? Because it's not helpful if you go home with information and you say, this didn't help me. Like, this didn't address the 3 things that I deal with. All right? So, hopefully you have those 3 things written down. What bugs me? You know, what are my main issues with providing care? Okay, so the first slide is list 3, here it is, we love that, those number 3s. List 3 steps, this is my job. Okay, so my job is to make sure when you leave, you also understand the 3 steps to take when trying to overcome behavioral issues with dementia patients. Describe positive responses to an aggressive patient or loved one, and 6 interventions to try when somebody's wandering. Okay, because that's a safety issue. Okay, when you've got wanderers. So that's my job. But the main thing is the 3 you have written down. Those are the 3 things that you really need to take home and implement. So I'm sure it will be addressed in those. Hopefully, if not, we'll get there. Okay, so I want to talk for a minute about the causes of behavioral changes. Physical discomfort, overstimulation, unfamiliar surroundings, complicated tasks, and inability to communicate. And we're going to break that down into basically 2 things. Okay, there's a lot there, but it's really just 2 things. Discomfort and confusion. All of those will fall into that. It's either they're uncomfortable or they're confused. Okay, so let's see how those fit. Number 1, physical discomfort. Yeah, okay, they're uncomfortable. Like they hurt, my knees hurt, my butt hurts, my arm hurts, I have to pee all the time, it's burning, whatever. They are uncomfortable. Physical discomfort, sometimes from medications. We give all of these meds, but all of those medications have side effects that can cause discomfort. For example, anticholinergics, things like antihistamines, they cause dry mouth. So now my mouth is dry. So you gave me this med to help with this, but now I've got this. As a nurse, whenever a patient who's fairly stable with dementia or Alzheimer's starts to get a little woo, like spinning off the rails, first thing we check, do they have a urinary tract infection? Now, they're not going to be able to tell you if it hurts to pee or you have to pee more often. They might not even feel that. They might not even sense it. I mean, women here, how many of us have had urinary tract infection? I had them and didn't know. We have urinary tract infection. I do. Yeah, we do. Okay. So they might not know, they might not feel it, or they might feel it but can't express it, but it is messing with them. It is throwing them off. Okay, so that's the first thing we usually check. So physical discomfort. So does that fit into pain or confusion? Pain. Okay, discomfort. Okay, all right, let's look at the second thing. Overstimulation, loud,
Sorry,
loud
we're back.
noise, loud environment. okay? Where does that fall? Pain or confusion? Confusion. Unfamiliar surroundings, where does that fall? Confusion. Complicated tasks? Confusion. Inability to communicate? Confusion. So what is your main thing that they're struggling with? Confusion. Confusion. Okay? So we look at the physical, and that's the first thing we look at. But the second thing that is more common is confusion. Okay? All right, next slide. So we see behavior. What are some behaviors? I'm just gonna point. Tell me a behavior that you, oh, where is this coming from?
Hitting.
Hitting, okay, we're gonna talk about aggressive, but definitely hitting behavior.
It would be emotions like crying.
Crying, like just volatile. Behavior that you've noticed?
Like, sometimes I gave you some kind of medication. They've been there.
Yeah, won't take it, okay? Behavior? Arguing, okay, so those are all behaviors that you're like, why are they doing this? Why are they doing this? Now, sometimes it's continual, it's not a new behavior. What we wanna look at is a new behavior, and also distressing, but usually like, yesterday they took their bath, why aren't they taking it today? What happened? Okay, so what's the behavior? First of all, is the behavior harmful? Okay, they're aggressive, yeah, that's harmful. Is it picking? Okay, well, that's not harmful, but it will be in about an hour, right? Okay, so is it parroting? Mom, 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 mom. That's not harmful to them, or harmful to me, right? But it's not harmful to them. So you have to kind of look at the situation. Is this behavior harmful? If it's harmful, that's kind of like a 911. You need to deal with it right away. If it's not harmful, then you've got a little bit of time to kind of think, okay, how do we fix this? Okay, you've got a little bit more of a time frame, all right? What happened before the behavior started? What happened after? Is it related to medications or illness? Okay, so let's take the pills. I don't want to take those pills. I don't want to take them. Okay, was she taking them before? Yes. Okay, so what's going on? Why is she scared to take that medicine? What's going on in her mind that she's afraid to take that medicine? Is there more medicine? Did all of a sudden there's a new pill? Like the doctor said, oh, we need to start to an antibiotic. And so she's looking at that going, I don't know that pink pill, I'm not taking that pink pill. Where did that pink pill come from? Right, so paranoia, okay? So those are some reasons that they might not want to take the medication. And we start, come on in, join the fun. So we'll discuss some ways to get around that, okay? But first identify. Okay. All right, now we're looking at solutions. We've identified the behavior, we've kind of identified disease. Usually you can work with new behavior. If it's kind of set in stone and they've done it for years and years, that's a little bit. But this is a new behavior. What happened before? Why is this behavior happening? All right, and then you look at solutions. Basic need of the patient, adapting the surroundings and changing your reaction. So we're gonna stick with the medication, okay? That's a really good example. Here's your morning medicine. I'm not taking that. You need to take your medicine. I'm not taking that. Well, the doctor says you need to take it. I'm not taking that. Right? Okay. So then can you read? Okay. Is dementia fixable? No. It's not fixable. Does it help to argue with that person? You are not going to change their mind. You are not. This is not fixable. So you cannot reason with them. Well, the doctor said it's really good for you. You really, really need to take it. It's not going to happen. Okay, so you have several other tactics. Oh, Mom, it seems like you don't want to take this medicine now. okay, I'm gonna set it here and you can take it in a half an hour. Then we distract. How about you come help me make some brownies? You're so good at making brownies. There is something that your loved one can do that they are good at. I don't know what that is. I would highly recommend making a very long list of things that they can do that they are good at. Let's think of some things. What are some things that somebody with pretty severe dementia can do? We're gonna go around, okay? Severe dementia, what is something that they can do? Fold laundry. Fold laundry.
Oh, I know.
Dust. They can dust. Dusting is good. I need you to help me dust. Yeah, work out in the garden. Oh, can you come help me pull the weeds? You are so good at pulling weeds. Come help me pull weeds.
How would they play music so they can sit and listen?
Yes, oh, you love music. Let's put on music. Now, think of something that music is a great distractor. We're gonna really focus on that. But think of something that they can actually physically do. Does that make sense? They need to task. How would you like it if you felt like your life had zero value? Zero. You were not contributing in any way. How would you feel? Useless, angry, frustrated, confused? So if your life has some value, you're going to feel like value. So what is something that they can do? It can be made up. Like you can just speak with them. Like, oh, Dad, you are so good at organizing my pantry. Is he good at organizing my pantry? No. Is he gonna take all the cans off and put it? Yeah. But that's fine. That's fine. Dad, why don't you organize my pantry? Can you think of something that you could direct a loved one to do?
Maybe setting a timer or setting like turning something in
Yeah.
on and off.
Yes, yes. Can you go check the AC unit, Dad? I don't think the AC unit's working right. What Dad would, okay, we'll check the AC unit for you. Dad, there's something wrong with the AC unit. Go check the AC unit for me. Is there something wrong with the AC unit? No, AC unit's fine, but that gives him a job, and he knows he's good at that. Okay, any other ideas? I don't want to put everybody on the spot. Yeah.
My aunts and my mom, my grandma's pretty, she was with it towards the end, but she would paint by numbers on canvases. And so now she painted tons of them, so now all my grandkids all have wonderful paintings that she did.
And you can praise that. Oh, I love this. This is the best. I want to frame this. Look what you did. So there's, you don't always have to like create something. There are things that they can do. So have a list ready in your mind of things that you know are going to make them feel needed, appreciated, right? Because I remember we went into a patient's home and there's this like square plywood with all these like metal things and nuts and bolts. And this is when I first started hospice. I'm like, what? They're like, that keeps him busy. That keeps him busy. And he would just sit there and twiddle with the nuts and the screws because he was in construction and that was what he did. So they created an activity board for him. I mean, brilliant, brilliant. Because he was sort of to the point that he couldn't really ambulate. So they would just sit him in a chair and hand him nuts, this board with all these nuts and screws in it. He loved it.
My mother sorted beads for my daughter's autistic class.
Yes.
And we bought beads, threw them all colors together, and then said sort them so that for this class, and she would sort them. I take them out to the car and shake it back up.
Oh,
Yeah.
it's so exactly.
My husband said it was elder abuse.
Elder abuse.
But it worked. It worked, and
Yeah.
she felt valued.
She felt valued, and I think that's the main thing, is that they need to feel like they are contributing. Okay, so that's kind of, we see the behavior, so we're gonna go back to that medication. She doesn't wanna take the medications because she's confused, there's some new medicine there I don't understand. Engage them in something positive, they are going to be in a better mental state. And when they're anxiously engaged, then you say, oh, remember, you said you were gonna take your medicine, not do you want to take your medicine. Remember, you said you were gonna take your medicine now. Thank you so much for doing that for me. You approach it positively with a positive statement, not a question. Do you want to know? It's like any 2-year-old, it's like me and my husband, do you know? They can know, So don't ask the question, you present it in a positive statement. Remember, you said you were gonna take this pill, I'm so thank you so much for taking your pill. Okay, make sense? All right. And different responses are gonna work with different. You're gonna find what works. Okay. All right. Let's talk about some general things. And most of you, if you are involved in caregiving, you're aware. So can you, let's look at number one, general tips. What about having a routine is going to be helpful for them? Can you think of how that would be helpful? Familiarity, right. So having that familiarity with the routine. The problem comes in is when you have caregivers, and most of us are gonna need help with the caregiver. And this is when the 3-ring binder, or just a bind, a notepad, or a whiteboard is essential. Because when you have other people coming in, they don't know your routine. And I can tell you the routine, and guess what? In, out, because I'm not going to remember all of that information. But if you have a whiteboard that you've got the routine, or a binder where everybody knows to go to the binder, you can be way more specific, and then they can come and review that binder. They can look at that and say, oh, that's right, we watched Mary Tyler Moore at 10 o'clock. They always watch Mary Tyler Moore at 10 o'clock, okay? Using calm, gentle tones and short sentences. I'm gonna role play for you. Okay, I'm exiting, okay? I'm trying to exit. Where are you going, Mom? I gotta go. I need to go home. Mom, you're home. No, I gotta go home. Mom, you're home. I gotta go. Mom, you're home. You see what I'm doing? What is that going to do? Increased voice, increased, talking faster and shaking. What emotion am I sending to my loved one? What emotion do you get when I'm, Mom, you're home? Frustration, anger, okay? So how are they going to respond? The same. Luckily, dementia patients tend to be slow in their processing, right? Their processing is slowed, which gives you a head start. Okay, so as they are having a hard time processing, it allows you a few minutes to take a deep breath. Mom, and then you respond. Okay? So that's the idea of the calm, gentle tones and short sentences. They cannot process what you're saying very well. They have slow processing. So if you use long, complicated sentences, you're not going to get it, okay? So let's talk for a minute about I want to go home. Hopefully that's on somebody's list. Why does somebody with dementia want to go home? Now, don't answer yet. All of you younger ones, you got some younger ones. Hold on. Okay, my kids, okay, strange reference. There's a really funny SNL skit about teenage girls going home for Thanksgiving. It's something Ballers. I don't know the name of it. Look it up. And it's these Cameron Diaz is in it. She's rocking out. It's these teenage girls, and they come home for Thanksgiving because guess what? It's familiar. Mom pays for everything. Dad will do everything for them. They can wash one sock, the whole batch, It's comfortable, it's familiar, and they feel, I'm looking for a word that starts with S. Safe. They feel safe and they feel loved at home, okay? Why does your loved one, your patient, say they want to go home? Because they don't feel safe and they don't feel loved. That's why they want to go home. They want to go back to mommy and daddy and feel safe and loved. You love them, they're safe with you, but something is going on that makes them feel not safe. So you have to be detective and figure it out. That takes a lot of work. But we also know they want to feel like they're contributing, right? They feel confused, they feel useless, they feel like they're not helping. So as mom's going for the door, I want to go home, I want to go home, I want to go home. You have to remember, they process slowly. You say, mom doesn't feel safe and mom is confused. I need to give her something she can do. Okay, mom, don't tell her she's home. You are not fixing this problem. In her mind, she is not home. Don't tell her, you're home, mom, you're home. You're home, we love you. In her mind, she is not home. Okay, you're not gonna fix that. So you say instead, okay, mom, yes, we can go, but let's make some cookies to take with you. Don't you think everybody would love some cookies? I love cookies. Let's make cookies. They would love cookies. Off you go to make cookies. Oh, okay, but first, let's fix your hair. Not do you want to fix your hair. Mom, let's fix your hair. It's looking a little in the back. You've got some roots showing. Come on, let's fix your hair. You will look so nice. Okay? All right? Because you're not going to fix this. Now, there's a difference. We are feeding into their hallucinations. And many nurses will say, don't feed into the hallucinations. But that is for a patient that has a different disease process, that with medications we can fix and bring them back to reality. You are not going to fix this. They are never coming back to their reality. In fact, it's just gonna go downhill. So don't think that you can fix it. So this is when you get to have fun. You're like, I am entering their crazy. I'm joining their crazy. Let's go on that crazy bus together, okay? I don't want to eat this. It's poisoned. Somebody poisoned my food. Okay. You're gonna say, Mom, it's fine. It's fine. It's fine, Mom. Eat it, Mom. No. Okay? Join in the crazy. Get on that crazy bus. Oh, let me see, Mom. Oh yeah, no, we don't, no, we're not eating that. I'm gonna tell the police about that. No, you're not. I'm gonna call the police and report them. I can't believe, oh, that's terrible. Here, let me get you this instead. Join the crazy, have fun with it, because you're not gonna change their mind, and it's not gonna get better. Does that make sense? Now, we do want to look at the behavior with, if this is new, go into their crazy world, and then step back and be like, let's test her pee. Let's see if she has a urinary tract infection because she's spinning out, okay? But that would not be the time to say, Mom, Mom, are you sick again? You have urinary tract infection. You get crazy like that. We never. That's not going to help. Have you ever? Nothing drives me crazier than when my husband says, I don't know why you got so upset. Why are you so upset? You just need to calm down. What does that do to me? Like, I lose it. But yet that's what we do to our dementia patients when we say, I don't know why you're so upset. It's fine. Just eat it. It's fine. Off they go, because it's not fine to them. Okay? All right. Diversions. Okay. This is, you came up with the music. Music is an amazing diversion. Amazing. Photo albums, large books, great diversions. When can you use a diversion? You want to use it before the explosion, okay? If you have a 2-year-old throwing a tantrum on the floor, that is not the time to say, oh, honey, let's listen to this music together. They are in full-blown tantrum. If your loved one, you're seeing them spin out of control, you've missed your golden opportunity. You want to use the diversion when the behavior starts to escalate, not full-blown. Okay? When the behavior starts climbing and you start seeing that's when you're like, oh, time for music. And make a list. Have that ahead of time. Have your list ready to go. Because in that moment is not the time, your brain is just gonna be like, oh no, oh no, oh no, they're bouncing off the rails again. So have your list ready to go of diversion tactics. Okay? All right. Next. Okay, before, we can stay on this slide, but just for a second, I mentioned it earlier, do not ask direct questions. Make positive statements. Don't say, well, dear, do you want some coffee? They will typically say, no. I mean, they might say yes, but generally they're gonna say no. Instead you say, I made the coffee just how you liked it. I even put that special hint of whatever, haloperidol, no, I made it just how you liked it, okay? So make positive statements. Don't ask direct questions. They are so confused that they are going to respond with no, even when you know that's not what they mean. They are just so much stimulation going on that their immediate response is going to be no, 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 no. Okay, so make positive statements. And then listen to the expert. So in the dementia world, in our realm, in our reality, maybe I'm the expert of my life, but they live in crazy land, right? They live in a different world. So who's the expert of their world? They are. They are. So you need to listen to what they are saying to you because it's their world and you are not going to get them out of it, okay? So you need to listen to what they're saying and believe them. Okay, don't contradict them. Okay, like I said, you're not getting them out of crazy land. They're there. And then something that just my little notes that I scribbled here. Don't reason, don't argue, don't confront. Don't remind them that they forgot. Oh, you forgot. How there are certain things. As we age, we want to remember our prime of our life. Please don't remind me, oh, you wet your pants again? Do I need to change your diaper? How does that make me feel? Oh, you forgot again. You keep forgetting. I told you 100 times and you keep forgetting. Okay, that reinforces to them that they are worthless, that they don't know what's going on, right? And that they are a burden. So we say to them, oh, it looks like we need to change your clothes. That's it, you are stating out. It's not, do you want to change your clothes? No, they don't want to strip naked in front of you. No, they'd rather sit in their wet pants than be stripped naked in front of you and be embarrassed. So you just state it positively. Oh, hey, let's change your clothes. Let's put on some different pants. I think you like the pink pants better than the white pants. Okay? All right. Okay, so we're gonna go to the next one, the aggressive person. Okay, so we're talking about aggression because that's a safety issue more than, okay, it's a safety concern. Why do you think somebody would become aggressive? Like, what would be a reason? Or let me rephrase it. So raise a hand, who's got a loved one in their home that they are caring for? I know you do.
Well, mine was gone, but.
Okay, but they did. You do, you have, okay, you do. Okay, so what do you think, like, what have you seen in aggression? Like, what kind of aggressive behaviors have you seen? biting, pinching,
Throwing.
throwing. Have you seen anything?
No.
Not that, they might, not everybody becomes aggressive, but it's very common. Grabbing too hard. Mm-hmm. Don't do that.
My mother-in-law, she also suffers from anxiety, so it's kind of, she has a little, dementia and anxiety, so when she gets anxious, she'll start to grab onto, a person's arm,
Yeah,
and, every so often, she'll try to grab my son out of my arms.
yeah. Okay,
Yeah, so.
okay, and what have you seen?
More maybe like an arguing or maybe like, wanting to get the walker and sleep.
Yeah, just give me this, yeah, they're not able, okay. What have you seen?
She didn't want to talk. Whatever we asked her, she just no response at all.
No response, okay. So we're gonna talk a little bit about those, and then we're gonna talk about the aggression, because they're a little bit different, but it is a behavior.
Yeah.
Okay, so the aggressive behavior a lot of times comes up when they are presented with a situation they do not want to participate in. I don't want to do this. So I show aggression because I don't want to do this. Bathing, going someplace, we need to go to the doctors, you need to get in the car, okay? It's something they don't want to do. All right, well, too bad, so sad. I don't want to do laundry, but it's got to get done, right? There are certain things that have to happen. So this same thing, they process slowly. So you have to get your game on, and you need to think of situations of how can I make this better for them? Bathing, shower. I don't want to take a shower. I don't like taking a shower. I don't want to do that. It's cold. I'm naked, so I feel extremely vulnerable. I don't really remember you, so why would I want to get naked in front of you, right? So this is when you get those creative juices flowing. How can I do this? When is the best time of the day, right? When are they feeling their best? That's when we do the shower, okay? Not because of routine, well, we always take a bath at night. That's when they're usually at their worst, okay? So when are they at their best? How can I reframe this? If they notice that they smell, great. If they don't, it's not really gonna help for you to say you stink. That's not a real powerful thing. But you might say something like, the grandkids are coming, they would love to see you, and I think you would look so good in this, whatever, let's get you in the shower. Not, do you want to take a shower? Because what are they gonna say? No. Okay, so try to reframe, and then also maybe schedule medications around that time period. In other words, I can give them some kind of medication for anxiety, whether that's Seroquel, lorazepam, haloperidol, whatever the meds are. If I give it here, in 1 hour, they're gonna be much happier, and it's still the nice time of the day, and I'm gonna reframe this. And it might even be maybe you don't take a shower, let's go swimming. We're gonna go swimming. Let's get your bathing suit on. Let's go swimming, right? So you can reframe it. Okay, aggressive behavior. When you mentioned that they don't want to respond, you're asking them questions and they don't want to respond, look at poor communication. Too many questions, too many statements. If I can't process, who here speaks a different language? Okay, do you remember learning the second language? You might have done it from birth, okay? We host exchange students a lot. And I always joke that they're mute. They don't speak because hi, how are you? You have a good, how was your flight? Do you want something to eat? Oh, They cannot process what I am saying. It's too much. So if you think about it that way, this person speaks a different language. I need to make my sentences short. I need to make them simple and expect minimal response. Does that make sense? They can't process what I am saying when I talk fast, and I talk fast. Okay. All right, response. Focus on their feelings, what their feelings, and not the facts. That's them. And then a 180 for us. Okay? We need to focus on facts for us and not feelings. Why do you have so much makeup on? You have so much makeup on. I won't say what you look like, okay? How does that make me feel when my loved one says I look like I should be hanging out on the corner on 9th Street? I'm your daughter, right? Okay, so for me, I cannot focus on feelings because that made me feel terrible. Not only does she not remember me, but she thinks I'm earning money in an illegal manner. Okay, so I can't focus on the feelings. I have to focus on the fact. Her brain is not working. Her brain is not working. But for them, I have to focus on feelings. Why is she saying that? What's going on here in the way I'm presenting or that she's remembering that situation? Because she might not remember me, but what's going on? Make sense? So it's a 180. Feelings for them and facts for us. You just have to always tell yourself, it's not my loved one, it's the disease. It's not my loved one, this is the disease talking. Okay? All right.
Next slide.
How do you deal with it in public when they say something like that, it's just someone you don't know, and they're standing right next to you? I did that a lot. You would go shopping and they would comment on what someone was wearing, or too much makeup.
You're just mortified. Yeah. So, humor. Humor and the same thing. Remember I said you gotta have your list ahead of time. Okay? And you say something like, well, Paul, that's dementia talking, isn't it? Right? So you're with your loved one and they say something totally inappropriate in a public setting. You turn to your loved one and say, Jean, dementia's talking for you right now again. And that, like just state, and that way they understand and the person beside you understands. I think our society has become more accepting because of the increase in autism of behavior in public that in the past people would be, So that's been my response. Well, Grandma, that's your dementia voice talking. Let's think of something nice to say, right? And try to have some humor in it rather than, don't say that. That's not nice. Okay? My nephew is very developmentally delayed, and he will just say the most inappropriate things in public. Very inappropriate. But he is 6'2", 400 pounds, and looks like they would look at him and know there's something wrong, right? But when it's your sweet little granny and she looks really cute, she doesn't look like there's anything wrong, and she says something just totally, off the walls, you're gonna have to come up with whatever your favorite statement is that lets everybody know, well, dementia's got a hold of you today, Grandma. Let's make sure we, go find our favorite cookie. Okay? Does that help?
Yes.
Okay. All right. So we kind of talked about the agitated person, that it's usually in the moment, you're just dealing with the behavior, but later you're going to have to look at the triggers so that you can avoid those triggers. Okay? So let's say you always go out to eat on Tuesdays and you're noticing Tuesday evenings, they're becoming more aggressive, right? They become aggressive Tuesdays. Tuesdays are our IHOP days that we meet everybody at IHOP for lunch. Maybe that's too much for them. Maybe going to IHOP, you're thinking is helping, but then later they're showing aggression. So maybe IHOP isn't helping, right? So you have to be that detective to figure out what is stimulating this aggressive behavior. There's a lot of triggers. Bathing seems to be a big one. Okay, all right, let's go to the next one. All right, the confused. Remember I said there's two things in dementia that cause behavioral changes: pain and confusion. With confusion being the biggest one, okay, the more common. So, there's not much you can do. They are confused. And you cannot unconfuse them. So trying to explain it or, oh, don't you remember? Remember? No, they don't remember. And you telling them to remember is only going to make them feel more confused. So photos are good. Photos are good, especially in the beginning of dementia. That helps. But later they're looking at a picture and like, remember, that's me. You're like, nope, don't remember. So photos help initially. At the end of the stages, not as much. Brief explanations, because they are slow to process. The longer the explanation, the more confused they become. Keep it short. Keep it simple. And not a question. State it. Okay. All right. Next one. Hallucinations. Who here likes to fall asleep with the TV on? Okay. My mother-in-law, she was fine. She does not have dementia, but she was in the hospital post-surgery, and she was convinced that somebody was going to kill her, that the police were there and they were going to kill her. Because guess what? She was watching on TV when she fell asleep. CSI. Okay? All right, don't mess with your brain. So if you have a loved one that has dementia and the TV is on, because sometimes you feel very isolated and you're like, I need to get out of this house, so I'm gonna have the TV on. That is very confusing to them because they cannot differentiate. Okay, so TV, especially at night, not a great idea. So shadows, mirrors, those things can all make hallucinations worse. We do not, in psychosis, we say, no, there aren't little green men, Mr. Jones. There's no little green men, because we can change psychosis. We can medicate and get them back to reality. Dementia, you cannot medicate and get them back to reality. So there's little green men? Well, I'm gonna get the green men brush. I'm gonna brush those green men out of the room, okay? You wait right there. I'm gonna get the brush. Okay, the green men are gone. You feel better now, huh? Don't you? Okay? You can't change their crazy, so join in. Do not argue about the hallucinations. Look for feelings behind the hallucinations. What are they scared? Is there something frightening them? Same thing, calm, supportive, especially if the hallucinations are frightening to them. Okay, they're scared. Okay, they need to feel safe and loved. When they're confused, they don't feel safe. So if they're hallucinating, maybe they don't feel safe. What's going on that they don't feel safe? What happened today? What's happened? Okay, so you are detectives. When you're done, you'll have like a police detective badge. All right. Okay, repetitious behavior. Mama, pick, tap, tap. Where's my purse? I need my purse. Where's my purse? Hiding the purse, Okay, repetitive behavior. First, you have to decide, is it dangerous? Mama. That is not dangerous. It's annoying, but it is not dangerous, right? Picking, not dangerous the first 2 minutes. An hour later, when their hair's falling out or their scabs, okay, so we have to look for that. We'll get to it in a minute. There's medications that help. We can help with meds we cannot fix, okay? So same thing, try and figure it out. Why are they doing this? What's happening? And sometimes there is no reason. Sometimes there's just not. But if we can get that, sometimes you have to accept the behavior. Sometimes you can change the behavior, especially with parroting. Parroting, like, saying the same thing over and over, mama, 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 okay? You say, oh, mama, let's sing it. Oh, mama, oh, mama, oh, mama, hey, daddy, hey, daddy. And then they start saying daddy, and then you look at your spouse and go, hey, it's yours now. So you can have fun with it, and you can try and steer it in a more positive way. Singing is usually the best tool for parroting when they're talking, that repetitive talking. Is somehow try and get it to be a song, and then move that song to a song that's not so annoying. Okay? All right. I skipped something. Oh, that was on mine. I just skipped.
Okay.
Okay. Who here knows what sundowning is? Okay, what's sundowning?
Towards the evening is when we start seeing escalation in the behavior.
Yes.
And it's usually all the things that you were describing, and they all sometimes come together
At one time.
at the same time.
Yeah.
And then that's when usually we come in the picture, and families kind of, you do this.
You do this.
That's why
Okay.
we're there.
Yeah, so when the sun goes down, the crazy comes out, okay? Sundowning is, in the evening, we see a very large increase in this dementia behavior. All right, we are smart people. Why do you think that happens? What do you think is causing that? If we've ruled out they don't have any infections, they don't have urinary tract infection, nothing has particularly changed in the environment or the routine. It's all been pretty stable. Why, when the sun goes down, do the behaviors change so dramatically?
Are they tired?
Tired. They are tired. And keep bringing up my husband. He's like, you are so grouchy when you get home from work. Because I'm tired. Right now, I answer the phones. So if you call community hospice, I'm the triage nurse. So he sees me in that little office and I answer calls all day. Community hospice and health services, how can I help you? Right? By the end of the day, my niceness is gone. My niceness factor is in the tank. So I am cranky. But in the morning, I feel better. It's the same thing. They have had to try and process this confusing, scary world all day. And by the end of the day, they're just done. They are cranky. They're done trying to control that behavior. Here's something you can relate to. I think most of us try to eat healthy. And in the morning, we're good. And at lunch, we're pretty good. Dinner, we're squeaking by. 8 o'clock at night, if there's a cookie inside, it's going down. We're going down. That whole container of ice cream gone. Because our willpower is shot. We've had to make healthy choices all day, and by the evening, we're done. That's their brain. All day, they try to figure out where they are. They try to think, what's the right behavior? What's the right thing I'm supposed to do? Who are you? I don't even know who you are. I'm racking my brain to remember this person who says they're my daughter. By the evening, they're just done. So the behaviors escalate. Just like before, when you see the behavior escalate, that's when you step in with your diversion tactics. Oh, you're so good at sorting these beads. We have the Girl Scouts coming over. Can you sort the beads? Right? Don't wait till the behavior's through the roof. Expect that medications can help. We don't want to medicate somebody into compliance, right? Like, drugged up zombies are not the goal. But sometimes that's your only option, and that's okay. So don't feel guilt about that, right? Don't feel guilt that I can't, because one, we think they need more sleep, and they actually, I think it's up there. They need less, decreased need for sleep. So we're like, hey, it's time for bed, because I'm tired of dealing with all of this all day, so it's 8 o'clock, go to bed. They don't need that much sleep. So there's a combination there of issues. Okay. Couple ideas, plan for more active days, keep them busier, which makes them tireder, so the behaviors might increase more, but at least they'll sleep more. So it's kind of, you have to find that balance. If I get them too active and there's too much stimulation, then the confusion comes in, and so their behaviors change, increase. Does that make sense? But if all they're doing is sitting around all day, not doing anything, that's not helpful either. So it's kind of a fine balance. Okay. One behavior that's very common is suspicion. It's this paranoia, right? Paranoia is very common. Somebody stole my purse. Somebody's taking my money. I don't have any money. Who took my money? Where's my car keys? You took my car keys. Those are all very common. Okay, remember, pain or confusion. They're confused because guess what? You did take their car keys. You did take their money. I mean, like just for their safety, right? So all of their adult life, they needed those things to be independent. They needed their car keys. They needed their money. That gave them a sense of independence. And now they are totally dependent on you, and they don't want to be dependent on you. They want their car keys, and they want their money, and they want it now, because they want to leave. Okay? So find ways to make them feel useful. Same thing, they don't feel needed, they don't feel independent. So help them find ways to feel useful. That will help a lot. Okay. Wandering. Oh, okay, we will wrap up because we're almost done. Okay, wandering, we talked about that they are trying to leave, to go to another place because they're confused where they are. Where they are is confusing to them. They don't understand where they're at. They want to go someplace that they remember, but there is no place. So as they're leaving, they're looking for something that doesn't exist. So just remember that. When they are trying to leave, they're trying to go back in time to a place that doesn't exist. Okay, so just remind yourself of that. Okay, all right. Some drugs make things worse. Skip. Especially Benadryl, that's very common. That can make things worse. That's an antihistamine. Okay, yeah, skip. Skip. Meds help, but we're going to skip the meds. We're just going to skip all that. Okay, because the meds aren't always the answer. They help, but they're not going to cure. Okay? So they're not going to fix it. Don't waste your money on Alzheimer's meds. They don't work. They don't work. Okay? So there are medications. See your physician. Encourage your family of your families that you care for to get some medications to have available when things are getting out of control, so that you can help calm the situation until you got your detective on and can figure out how to fix it so that you don't need meds the next time. Does that make sense? Okay. All right. So I asked you to write down 3 things. Did we address those 3? Did those 3 things get brought up? No?
There's one.
Okay. What did you get brought up?
Caring for family members, maybe were absent, doing your childhood, now you have to care for them. So there's that dynamic of relationships, or they never had it, or maybe they were abusive when, they were previously, and then now they have dementia, you have to care for them.
Oh, we see that all the time. Yeah, so mom and daughter never got along. Daughter's like, see ya, for whatever reason. And now daughter is expected to care for mom. And she's like, I don't want to do this. I didn't sign up for this. Or if they did, they're like, there's all this. That is, that's where our social workers come in. Because you can't change mom. Yeah.
I had a mom that her and I never got along. I was always not good enough. And I ended up taking care of her, and I think it was God's way of giving me a relationship with her before she passed. Because I did care about my mom, but I couldn't be with her because of the way she treated me.
Yeah.
So I honestly think the time that I spent with her, it gave me that relationship.
I think this is a good, when you have the support, I would recommend a support system because there are many, many, many caregivers that fit somewhere on that spectrum of like, all the way over here where I want nothing to do with this person, but now I'm required to care for them. And just hearing people, I think will help them validate, because that is a very internal struggle.
Because ourselves, we have to change ourselves.
Yeah.
For their situation.
Yeah.
The past, the past is the past. But right now, this is a need.
Yeah, yeah. Okay, anything else in your list of 3 that maybe didn't get addressed?
So dementia patients making abuse reports because they've been held hostage,
Okay.
like you said, like they're
Yeah.
and that can be really frustrating for families.
That's where diagnosis come in too for physicians.
Yeah, that's, okay, so one thing that I will mention.
That's where diagnoses are important.
Yes, diagnoses are very important. One thing that I will say to I think this is kind of my social worker side here, is encourage your family when the dementia is first diagnosed, encourage them to get a thing from their primary care physician that states they are no longer capable of making decisions. Because once they come to hospice, they think hospice can do that and we can't.
Yeah.
Ethically, we are not allowed to. So they'll come to me and say, Mom is so bad and we need to get into her bank, and we say, we can't. Ethically, we're not allowed to do that. So that's when social workers need to step up and say, hey, this is what's happening with Mom or Dad. You need these letters now so that you can help with the bank. But yes.
So the primary care doctor can help with that.
Primary care doctor is the one that will issue the letter that says they are no longer capable of making decisions. Yeah, so they need to get that, because once they get to hospice, and a lot of times they'll be like, well, I haven't seen my primary care doctor in 3 years. He's not gonna write that letter, and all we can say is, I'm sorry. So having that letter will also help with police reports, saying, look, she's not competent.
And more often than not, the hospital doctors will not do those.
The hospital doctors
And it's
will.
good to know because we sometimes get families very initial stage, and it's good to know to
Yeah.
educate them
Yeah.
on this, because it's gonna happen one day.
Yeah,
And
yeah. So get those letters sooner rather than later, because when the police show up, you can say, look, you're crazy, sorry. I'm trying to be flippant, but like, you have to take humor in this. And then, like I said, once it gets too bad, then you are not going to be able to get them in the car to go to the appointment. For them to do that, because they're like, I'm not going, so they're really stuck. So encourage your families, as soon as that diagnosis hits, is to get those letters, because that will help them. So thank you very much. I hope.
You did a great job. I have one question, and we've been watching you on this. I didn't want you to go to my
Hello, I have one question.
Thank you. Good job, Shelley.
I have a question.
Thanks everybody for coming.
How long before that gets posted online?
Your visitor just put